One of my favorite procedures may be the thumb CMC arthroplasty, where we take someone that has a really painful thumb. Typically this will be like the 55-year-old female has a hard time opening jars and bottles, and their thumb hurts, and then when they write for a long time, their thumb also is sore. And what we do is we take that bone that's riddled with arthritis and full of pain. We actually physically remove that bone, throw it away, and throw away all their pain. And in lieu of that bone, which was taking up that space, we will fill that space with a tendon that we can harvest from the forearm. It's crazy that you could take a tendon and you won't lose any function, because it's a duplicate tendon, so there's other tendons that do exactly the same thing. So you could harvest that tendon, use that tendon to fill up that space and hoist up and suspend the thumb so the thumb doesn't collapse. And that's called a thumb CMC arthroplasty with a flexor carpi radialis tendon transfer. Sounds like a mouthful. Sometimes we just call it basilar joint arthroplasty. There's several other names for it. But it's been around for about 40 years, and I love it because people do so well with it, high success rate. It's an outpatient procedure. It really does change their lives. We have patients that can barely open Ziploc bags, where they're using their teeth to open bags. They can't pull up their socks. They can't even do the most basic things, from waking up to pulling up your socks to opening a little bag. Can't open any water bottles. And all of a sudden after the surgery, they regain a new lease on life because they have all these capabilities that they lost and were so depressed that they can't do those things anymore. And now they can do it all themselves without any assistance. So that brings a lot of satisfaction. That's a surgery I enjoy doing.